Hi, Professor Hill and classmate. Today we had Lily, 47 years old, a Hispanic female, and she came to the clinic because of the moderate to severe headache in the right frontal and around the orbit. And she said recently the headache getting more, and she has 3 times headache per week, and it lasts from 1 hour to 4 hours. Um, when I asked her more detailed questions, she said the pain is in a scale of the between 5 to 8 from 10, and getting worse with the smell of particular food, and get better with the over-the-counter medicine like NSAID and caffeine and hydration and rest. In past history, she doesn't have any significant history of the any disease. Physical exam, the last time was last year, and no allergy to medicine and environmental allergy. She's taking ibuprofen, ondansetron, and multivitamin over the counter, and immunization was updated. Last flu shot was last September. She's living in apartment with her husband and 1 kid, and she has a support from family and friends, going to Sunday church. She's sexually active, but she has her menopause last year, and she doesn't smoke, drink, or using any illegal drug. She's eating mostly homemade food and nutritional food, and a sleep pattern didn't change, and she sleep like 6 hours per night, and exercise, like she's going to gym 2 to 3 times per week. A family history from like a mother's side has hypertension and diabetic and high cholesterol from that, and grandmother passed away from the stroke at age of 70. Grandpa passed away at 82 by just he had Alzheimer and diabetic. She has another sister. She's healthy. In Ross, everything looks good, and she doesn't complain of fatigue, fever, anything like that. And she just mentioned about the light headache for today, and moderate to severe headache 3 times per week. And as I said, it's gonna last 1 to 4 hours. With the smell of some food, the headache started, and sometimes it's getting worse. And during her menstruation period, it's going to be worse. NSAID, medicine, and caffeine and hydration going to help her. She doesn't report any dizziness. All the other system was normal. She doesn't mention any like a report for any of them. And after that, we just checked the vital sign. Everything was normal. BMI was in the good range. In general, she's alert and oriented. No fever, no fatigue. And today, just a light headache. In the head, there is no lump and lesion. When I did the physical exam, sinuses was checked. No tenderness and no pain. Other system was normal. And when I checked the neuro, she has a little like a tenderness when I touch in the right frontal and around the orbit. It was a little tenderness to the touch. I checked the cranial nerve. Everything was normal, and no sign of tingling, paralysis, and numbness. My differential diagnostic was the most likely diagnosis migraine. And migraine is the headache. Is going to be unilateral or moderate pain to severe intensity, and it's going to be in one side or bilateral, and sometimes coming with aura or without aura. It's lasts from 30 minutes to 4 days. And the other differential is going to be tension headache. Tension headache is like a kind of mild to moderate, and sometimes if it's getting severe, tension headache is going to be confused with the migraine, and it's causing the throbbing pain in one side or both sides, And chronic tension headache happen more than 15 days per month, and this headache gonna last from 30 minutes to a few days. And we are gonna rule out the tension headache, and the other differential is gonna be head tumor, and we are gonna just order MRI and CT scan. And with this imaging we did, we rule out the head tumor, and head tumor is coming with like a headache in the morning, and sometimes the patient has nausea, vomiting, and vision or hearing problem. And we did rule out the head tumor too. And my plan is I'm gonna check the like a routine test, check the CBC for anemia, CMP, electrolyte, to see if there is any changes, and MRI and CT scan for like a tumor or any pressure inside of the like a skull. And for treatment, I'm gonna continue the over-the-counter medicine she's taking, and the treatment of migraine is gonna be stopping the symptom and preventing from the like getting the severity of the headache.